But what could we expect by giving the supplement to a stroke victim that's paralyzed, like on their left side? But it's like, is there any hope after a stroke?
Well, of course. Well, first thing you have to appreciate, there's two basic types of strokes. 85% of strokes are a blood clot in the brain, in an artery in the brain. 15% are ruptured aneurysms in the brain, hemorrhagic strokes. Hemorrhagic strokes are caused by deficiency of a single mineral. The blood clot strokes are caused by the deficiency, I'll tell you this one, omega-3 essential fatty acids, because this one I actually sued the FDA in federal court and prevailed in federal court to be able to say this. Like getting put in jail, see? That blood clot strokes, which make up 85% of the types of strokes, is caused by an omega-3 essential fatty acid deficiency or a ratio problem between omega-3, 6s, and 9s. So that's part of the essential nutrients. Now what we do, we actually have a program when somebody has a stroke, it'd be the Healthy Brain and Heart Packs, and it has all these things for the right ratios and the right amounts of the omega-3, 6s, and 9s. Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. We'd throw in the synaptives so the brain cells talk to each other again. Mm-hmm. And then we throw in something that's really kind of funny. It's called Ultimate Niacin Plus. Now, it'll dilate arteries, and even though you have an old stroke in there that's got a lot of scar tissue in the blood vessel, maybe plugging up that artery for maybe a couple of millimeters by maybe 75%, well, it dilate that artery, increase the blood flow by 50% through there just because it dilates the artery. But it has a little enzyme added to the Ultimate Niacin Plus called nattokinase. And nattokinase, if you look it up, all it does is digest blood clots. So if you have an old one, it might take a little while to digest it, but if you have a new one, gone in seconds. Oh. So if I worked in a hospital, I'd have myself a little bottle of this injectable nattokinase, and anybody who came in who had any of the symptoms of a stroke or coronary thrombosis or blood clot in the heart, I'd be giving them an injection right there instead of having them sit there for an hour waiting for service while their brain is dying or their heart is dying from that obstructed artery. I'd give them that right away. It won't hurt them, can't do anything negative, and it just might digest the blood clot, and by the time they see the doctor, they say, well, there's nothing wrong with you.
Wow.